everyone, in this video we are going to discuss about who is at risk of contracting gonorrhea. Also, we are going to discuss about complications of gonorrhea if left untreated. Number 3, we are going to discuss how do you diagnose gonorrhea. Number 4, we are going to discuss treatment of gonorrhea. And number 5, we are going to discuss prevention of gonorrhea. Previously, I had done a video about what is gonorrhea, how gonorrhea is transmitted, the incubation period of gonorrhea, and the signs and symptoms of gonorrhea. So, if you want to learn more about gonorrhea, for you to understand this video, first you need to go and check in my YouTube playlist and find that video so that you can be able to understand this video better. If you like this video and you benefit from it, hit the like button, share, comment below, and most importantly, help us by subscribing. I'm Wahinya the doc. The purpose of doing this video is to simplify medical conditions for you. So, who is at risk of getting infected by bacteria? Number 1, if you are young female, I mean you are a teenager, you are at risk of getting infected by gonorrhea. Generally, their cervix has a physiological changes that make them more predisposed to getting gonorrhea. Number 2, if you have a new sexual partner or you have got yourself a new sexual partner, you are at risk of getting gonorrhea. Number 3, if you have multiple sexual partners, you are at risk of getting gonorrhea. Number 4, if you have other sexually transmitted diseases, you are at risk of getting gonorrhea. Number 5, if you had been diagnosed previously with gonorrhea, you are at risk of getting gonorrhea. Number 6 is having sex or sexual intercourse with a person who is infected with gonorrhea without using a protection. So, number 2, we are going to know what are the complications of gonorrhea if left untreated. Gonorrhea has very severe complications. One of the complications is that you can become blind. In the other video, I said about how gonorrhea infects the eyes. Gonorrhea infects the eyes in 2 ways. One way is what we call vertical transmission. Vertical transmission means if a woman is pregnant, is giving birth, and this woman is infected with gonorrhea, the baby will get infected by the gonorrhea in her or his eyes. If left untreated, this can result to blindness of that baby. Number 2, an adult can also get infected with the gonorrhea of the eyes. That is in case you are having sexual intercourse or foreplay and you touch the genitals of your partner who is infected, then you touch your eyes. This will lead to infection of the eyes. Other complications, when gonorrhea infects women, one of the complications is that it can lead to infertility. Infertility is usually brought up by when the gonorrhea is not treated. It usually ascends from the vagina and it enters into your womb or your uterus. In the uterus, it moves to the fallopian tubes. Then it causes infection of the uterus, the infection of the fallopian tubes, the infection of the ovaries. Then it broke. This can result, if not treated, it can result to the blockage of the uterus. So, fertilization will not happen if you have the blockage of the fallopian tubes. Then you can develop what we call, you can have increased risk of having ectopic pregnancy. Ectopic pregnancy is a situation where after fertilization, that egg does not implant itself in your womb. So it ends up getting implanted in other areas, but the most common area is in the fallopian tube. Gonorrhea usually cause the damage of the fallopian tubes. Your fallopian tubes usually have hair-like structures. Those hair-like structures are the ones that beat. They usually beat. They are moving, so they usually beat or sweep the egg from the fallopian tube to your uterus for implantation. So the bacteria will damage those hair-like structures that are in your fallopian tube. So when the egg get fertilized, it won't be able to move from the fallopian tube to your uterus. Number 3, for males, for men who get gonorrhea and it's not treated, they can get infertility because the gonorrhea will go and affect your testicles. Your testicles have structures that store sperms. Those structures that store sperms can get blocked, so your sperms will not be able to move out from your testicles to the urethra. Then gonorrhea can affect the skin. It can cause rashes on the skin, causing dermatitis. Dermatitis is a condition of the skin. Then from there, gonorrhea can affect your heart. It can affect your heart valves if not treated, and it can also affect the inner layer of the heart. This will cause what we call endocarditis. Endocarditis is a disease of the heart that affect the most inner layer of the heart. And also, if your valves get infected, that one will cause valvular diseases of the heart. Number 6, if you have gonorrhea, you have increased risk of contracting HIV infection. Gonorrhea can, if not treated, especially in those people who their immunity is compromised. Those people who have low immunity, maybe you have HIV, or you have cancer, or you are taking corticosteroid medication. Those are medications like medication for asthma, and also, or maybe you are diabetic. Your immunity is low. So in such cases, if you contract gonorrhea, it can end up causing meningitis. Meningitis is an infection of the layer that separates the brain and your skull. There is a layer there that is called meninges. So infection of the meninges causes meningitis. Number 8, you can complicate to get septic arthritis. Arthritis, there are so many types of arthritis, more than 7 types of arthritis. So septic arthritis is where your joint accumulate pus, because the bacteria will move with the bloodstream and enter into your joint and cause pus accumulation into your joints, resulting to septic arthritis. From there, I want to teach how you diagnose gonorrhea. Gonorrhea is diagnosed in 2 ways. One is where you get a swab. Or you take that discharge and you do culture. This one will show the bacteria in that test. You can also do a urine test. Urine test will also show the gonorrhea in your urine. Also, for treatment of gonorrhea depends with the severity. Injections that are used to treat gonorrhea, and also you have other oral antibiotics that you can swallow. Make sure you consult your doctor about the treatment. Don't self-medicate, because self-medication has led to treatment failures. Sometimes you are self-medicating yourself and you are not sure whether you have gonorrhea or you have other sexually transmitted infections. There are so many types of sexually transmitted infections that can present like gonorrhea. How do you prevent yourself from getting infected with the gonorrhea? One way is to make sure that you use condom during sexual intercourse. Number 2 is to get screened for gonorrhea with your partner. I usually see patients, when they have a new partner, they only focus with testing for HIV. You should, when you get a new partner, you should make sure you don't focus on HIV only, because you need to focus on gonorrhea. So you need to do a urine test. Number 2, you do a blood test for syphilis. Number 3, check HIV. Number 4, check hepatitis B. Hepatitis B can also be transmitted like HIV sexually. In this video, I've discussed about the risk of contracting gonorrhea, complications of gonorrhea if left untreated, then how to diagnose gonorrhea, treatment of gonorrhea, and how to prevent yourself from contracting gonorrhea. Thank you. Make sure you subscribe.